Hi there everyone and welcome to this national networking event. I'm Gillian McAuley. I'm the Acute Nurse Director in NHS Lothian. Massive thanks to June for inviting me to speak to you today. Sorry I can't be in the room, but I'm hoping this virtual recording will do my presentation some justice, which is called the Collaborative Caring Supporting the Role of the Unpaid Carer, with that focus in on hospital discharge. The content of my presentation will focus in on the national context, person-centred care, leadership, change, and end with a bit of a pledge for you all to take away. Setting the scene and focusing in on both that legislative framework and also the policy that where this really important and key piece of work is embedded. So the Carers Scotland Act, which you will all be familiar with, in Priority 5, where carers should and need to be involved in hospital discharge. There's also the principles of realistic medicine, whereby we know when patients are better informed, along with their carers, they make different decisions, and those decisions consistently usually result in less treatment. We also know that 20% of healthcare doesn't improve health, and why there's a need and a drive to really support the 6 commitments set out in the value-based healthcare programme. And the 6th one of them focuses in on equal partners in care and shared decision making. And we can only do that if we involve carers as part of that. And then close to my heart, I am an ambassador for Joan's campaign, which is a campaign to support the rights of people with dementia to have their loved ones, families and carers with them during a hospital stay. And for me, that really changed my mindset and my thinking around how do we involve carers in all our care processes, but also within that discharge process. And it really set the direction in NHS Scotland for our open visiting principles. If we're going to deliver involving carers in hospital discharge, we need person-centred processes, we need person-centred leadership, and we need person-centred outcomes for people. At the heart of that is respect, where we hold a person's values that are central to our decision making. Listening and understanding what matters is a key in supporting others to achieve their goals, and we can only do that if we do that alongside both our patients and their carers. And actively engaging with a person's preferences, their goals, abilities and lifestyles leads to meaningful, authentic engagements and results in better, shared and informed decision making. And we can see how this really relates back to those principles set out within policy. And that everyone does need to be seen as an equal partner in care, where care is coordinated across the care journey, and we have processes that reflect the values of people, their families and their carers. And for me, this is a fundamental cornerstone of how we will take this work forward. I believe that we're all leaders and that we should all regard ourselves as leaders, no matter what role you're playing and who you are within your own organisation, you're a leader, and that we should support systems to support unpaid carers, but also enable an integration of joint working. And that we should make sure that our carers are co-designing that discharge process, and that we should empower our staff who are working with unpaid carers. And this comes from the Healthcare Improvement Scotland Change Package, which are some of the key drivers for change. I also think as leaders, we need to be aware of that strategic context, really focusing in on transforming relationships because of transform a system, this will be about how do we transform the relationships amongst the people who shape the system. And spending some time on that balcony and not always being on the dance floor. If you're on the balcony, you've got a much more strategic view of the system that you're working in and how you will take forward and support that involvement of carers in hospital discharge. Some of the change ideas within that change package, and I'm sure you'll get an opportunity to discuss some of them throughout the day, but how do we identify our carers? How do we record that a patient client has a carer within that care plan? And that might be quite a systems change for organisations. How do we ensure that we've got robust communication across that care team? And how do we both support and consult our carers to make sure that we are doing that meaningful engagement and developing those authentic relationships? I quite like the 3 horizon approach where we focus on the right now, that horizon 1. What are our current issues? What are our current our solutions, our approaches to this problem, and what are the short-term actions that you might want to take away? And that might be something that you want to focus in on today. And then what action is required over a bit of a longer period of time, 3 to 5 years, but I wouldn't even say as long as that, maybe over the next year. What is the long-term goal and vision for the future within your organisation? Maybe focusing on that horizon 3 and working your way back. But ultimately what we want to be delivering is better outcomes that matter to people with the best use of our resources that we've got available at the time. Today is a really important day. This is a really important networking event. We won't get today back. Let's spend it well and really consider what action you as individually can take or you as collectively across your organisation. And what I would urge you to do, there's no such thing as a free lunch. I would urge you to really focus in on what is the one thing that you will change by Easter. So it's early this year. What is the Easter Bunny going to bring in relation to involving carers in hospital discharge as a result of what you've heard today at the networking event? Thanks so much for your time. My contact details are there. I would love for people to email me, message me on Twitter, and I would love to hear feedback on how today's event has gone. Thanks so much and be kind to yourself.